We're back to our coverage of the COVID-19 pandemic, where reports say the federal government's failure to provide a single recognized vaccine database has been alleged to be the major reason the United Kingdom refused to approve Nigeria's vaccine certificate. And for more on this development, let's talk to a public health consultant, Dr. Nseabasi Ekanem. He joins us live via Skype in Lagos. Good to have you join us, Dr. Ekanem.
Good afternoon, and thank you for having me.
So if you remember, there were explanations earlier as about Nigeria being on whether the red list or not the green list. And then, there were explanations that, look, this is just a policy of reciprocity. It has nothing to do with whether we have defaulted in some areas. What do you make of this recent report saying that it's the failure of Nigeria to present a valid database to authenticate vaccines here in Nigeria? That's why we're experiencing, travelers are experiencing whatever they are experiencing in the UK.
Yes, thank you very much. I would say that I had the same sentiment earlier on, given the fact that in terms of management of database of people who have taken COVID-19 vaccine, honestly, it has not been so robust. You find out that whereas in many other countries of the world, like in the UK, in US, there is a central database system that tracks all persons who have received COVID-19 vaccine and can be submitted to regulatory authorities. That is not obtainable in Nigeria. We have a lot of racketeering. We have a lot of issues where people don't even know, how many. The exact number of persons in the country that have taken the COVID-19 vaccine. So this is a major challenge, and I keep saying that. We do a lot of things. We do a lot of interventions in Nigeria, but unfortunately, because we do not have database to support this, it becomes a challenge. So, for example, right now, if you want to find out how many persons exactly have taken the vaccine, all right, in this country, both the Moderna vaccine and the AstraZeneca vaccine, you may not be able to get that data from a central system, which is problematic. And we have that means a system that is connected to the national surveillance network, where all states, all primary healthcare centers that are giving the vaccine can report directly to that database, such that if UK or any other authority.
And this is not just about traveling. I mean, when you travel, you have to basically quarantine or isolate for about 10 days. But this even has implication for us in terms of our desire or efforts to curb the COVID-19 pandemic here, doesn't it? Because you just talked about the racketeering as well.
Yes. In fact, that is why up until now, if you ask the number of persons in terms of the percentage of Nigerians that have taken the vaccine, you only have an approximated value. That's not good enough. We should be able to have the exact number of persons who have taken the first dose, the exact number of persons who have taken the second dose, and even the number of persons who dropped out after taking the first dose. We should be able to have that data so that we can tell for a fact the efforts that we are making in terms of rolling out this vaccine. And like you said, the racketeering is another issue. And that's why, if you could recall the first discussion we had earlier, I mentioned the issue of racketeering. One of the reasons why most of these countries like UK don't trust our system is that we see cases of racketeering where people jump the queue. Some people even get the card without being vaccinated. There are a lot of Nigerians as well that have collected the COVID-19 vaccine but not taken the vaccine. And I'm telling you, this is a very serious issue and a dent to our image. So if we must get the approval of other countries of the world, then we must clean the entire system and make sure that only people who have taken the vaccine have access to vaccination card. That way we can guarantee that we have data on the exact number of persons we have vaccinated, and that way we can ensure that all those who are vaccinated who travel out of this country are truly vaccinated and should be given that recognition.
Absolutely, because if they can be certified and somebody who has not been vaccinated has a certificate, that puts everyone else at risk. Thank you so much for always for your insight and your time as always, Dr. Nseabasi Ekanem.
Thank you for having me.